What are the complications of untreated pulmonary tuberculosis? Have you ever wondered what happens when pulmonary tuberculosis goes untreated? This contagious bacterial infection, caused by Mycobacterium tuberculosis, primarily affects the lungs. If left unchecked, it can lead to serious and life-threatening complications. One major issue is progressive lung damage. As the infection persists, it continuously destroys lung tissue. This destruction can lead to cavitation, which is the formation of hollow spaces in the lungs, and fibrosis or scarring. These changes result in a loss of lung function, causing chronic respiratory symptoms like a persistent cough, chest pain, and shortness of breath. Another serious complication is respiratory failure. When lung damage becomes severe, it can impair the lung's ability to exchange oxygen effectively. This can lead to a situation where the body does not receive enough oxygen or cannot remove carbon dioxide properly, which is critical for survival. The bacteria can also spread beyond the lungs, leading to extrapulmonary tuberculosis. This means the infection can affect other organs, such as the lymph nodes, bones, kidneys, and even the brain. When tuberculosis reaches the brain, it can lead to a severe condition known as tuberculosis meningitis. Patients may also experience hemoptysis, which is coughing up blood. This occurs when the infection erodes blood vessels in the lungs, and in severe cases, it can lead to massive bleeding, which is a medical emergency. Long-term untreated tuberculosis can cause bronchiectasis, a condition where the bronchial tubes become permanently damaged and dilated. This makes individuals more susceptible to recurrent infections and chronic lung disease. Additionally, the damaged lung tissue can become a breeding ground for secondary infections, whether bacterial or fungal. These infections complicate treatment and recovery, making the situation even more dire. Chronic untreated tuberculosis can lead to systemic effects like weight loss, fatigue, fever, and night sweats. These symptoms occur due to the prolonged immune response and the body's struggle to cope with the infection. Ultimately, untreated pulmonary tuberculosis can be fatal. The risks include respiratory failure, widespread infection, or complications from massive bleeding or severe secondary infections. In summary, untreated pulmonary tuberculosis results in progressive lung destruction, systemic spread of infection, and a significant decline in health, potentially leading to death. Early diagnosis and appropriate treatment are essential to prevent these serious complications. Always consult healthcare professionals for guidance and treatment options.